The incidence of colorectal cancer is now, according to Cancer Research UK, the fourth most common cancer in the UK. It's the second deadliest cancer. Sadly, over 16,000 people die each year from the disease. And it does affect both men and women, but there is a high prevalence now of it affecting men over the age of 50. And of all new cancer cases being diagnosed in the UK, it accounts for 12% of those. The risk factors for colorectal cancer are some that you can do something about and sadly some that you can't. The biggest risk factor, of course, is age. 95% of people with colorectal cancer will be over the age of 50, although I think it's really important to remember that 2,100 will be diagnosed in their 20s, 30s and 40s. Obviously, there is a familial and genetic link sometimes to colorectal cancer. Generally speaking, the more family members you have in your family affected by the disease under the age of 50, the more likelihood that there is going to be a familial or genetic link. However, if you've only got one family member who was diagnosed over the age of 50, then you're at no greater risk than the general population. For patients with inflammatory bowel disease, so those patients with ulcerative colitis and Crohn's, we know that they may be at a slightly higher risk of developing the disease. But however, these patients should be known to you and will be on some sort of colonoscopic surveillance programme according to BSG guidelines.
The good news is that there are many things people can do to reduce their risk of colorectal cancer and stack the odds in their favour. We know that being overweight or obese are major risk factors for colorectal cancer, so helping patients manage their weight is important, including referral to weight management services or through very brief advice where appropriate. Dietary factors also play an important role, and patients can reduce their risk by decreasing their intake of processed and red meat and increasing their intake of fibre by eating more pulses, whole wheat bread, wholemeal pasta, brown rice, fruit and vegetables. Other lifestyle changes that can reduce the risk of colorectal cancer include stopping smoking, reducing alcohol intake and being physically active. The UK government recommends 2.5 hours of moderate physical activity each week for adults. And moderate physical activity is defined as anything that makes you slightly out of breath or warm, and that can include gardening, brisk walking or even housework.
The signs and symptoms that patients need to be mindful of and GPs need to be suspicious of is a change in bowel habit, and by that we mean a persistent change for 3 weeks or more, normally to a looser stool. If the patient says they've seen blood either mixed up in their stool or actually on the toilet tissue. If patients complain that they have lost an unexplained amount of weight, we need to investigate that. And for those patients who complain of really extreme tiredness, and any patient who exhibits abdominal pain. Prevention and early detection is really important for colorectal cancer. We know that those patients who are diagnosed with a Dukes A T1 stage colorectal cancer have a 93% chance of being alive in 5 years. However, for those patients who are diagnosed with a Dukes D or a T4 cancer, they only have a 7% chance of being alive 5 years on. The bowel cancer screening programme was introduced in 2006, which means that every patient registered with a GP between the ages of 60 and 74 in England will be sent a fecal occult blood test, the GUAIAC test, every 2 years, normally around their birthday. In order to determine whether a colonoscopy is required, the patient needs to produce a sample on 3 different occasions. The test actually determines whether the faeces has any blood in it. If there is no blood detected, then the patient will be sent another test in 2 years' time with a leaflet about signs and symptoms to be mindful of. If the test is unclear, then the patient will be asked to repeat the test. However, if blood is detected, the patient will be sent to the screening centre to see a specialist screening practitioner. The newer test, which is being introduced in England, is the fecal immunochemical test, known as the FIT test. And this is a test which has been piloted and is going to be introduced gradually. The advantage is that it's actually more sensitive to human blood, and so therefore it's more accurate. Bowel scope is also being introduced, and this is a one-off flexible sigmoidoscopy for patients who will be turning 55.